Wilson. So here's Dr. Matheson, and you're going to get some clinical stuff.
Brian, great job. Well, thank you. So I'm a practitioner. I'm actually a physician. I was an emergency room physician for 15 years, and I've been doing chronic pain management for the last 15 years. For the first 10 of those years, I was doing the classic chronic pain management that you would get in any clinic in the United States or Canada, all pharmaceutical-based, with some procedural medicine. And I was hitting a wall. It was like nobody was getting better, right? The pharmaceutical model was failing, and there's been no new pharmaceutical products for pain management in 15 years. They're out of ideas as well. And when I started transitioning people over to a more natural approach through an intervention I did myself, which did involve fasting and stuff, I had, within 8 months, had 8 patients lose 100 pounds and come off 80% of their medications. And I said, wait a minute, this is not what we're taught in medical school. So when I ran into Brian's work, as he said, I do have an undergraduate degree in lipid biochemistry, and I realized what he was saying was right. In medicine, you can't go up against big pharma. If you want to come up with a medical indication, you can't go up against one of those guys. They will just send lawyers after you and will bankrupt you, and they'll bury you. So I was in my patient population. I ran into some really, really sick patients, and so I said, "Well, where are we going to go with this? What am I going to do?" I noticed that people got better athletic performance, better skin, hair, nails, all these sort of generic things that a lot of supplements claim. But then I ran into this. So I had a 50-year-old guy who had a pancreas liver transplant for type 1 diabetes. He had an ulcer on his foot, and this ulcer was not healing. And he was booked for amputation, right? And that's, I don't know if you know the stats on amputation, but the 5-year mortality on a diabetic getting an amputation is worse than most cancers. And so I said, you've got to go on this stuff. It took me a while to convince me. He finally did. 5 weeks later, 5 weeks, and I've been doing medicine for 26 years, never saw that. They canceled the surgery. That's astounding, right? So I said, okay, that's a one-off. So then I had another woman. She was a vasculopath, had a cabbage, but came in crying to my office one day. She had a cold, dead right leg, and they were scheduling her for amputation. And I said, you have to go on. I just gave her balls. She couldn't afford it. I just said, here, start taking this stuff. And again, 4 weeks later, leg is warm and pink, and they canceled the surgery. And I said, this is crazy fast, right? I had no idea how powerful it was. So this is when we said, what about going and looking at wound healing? So I looked at the wound healing market, and Brian did as well. There is no pharmaceutical product in wound healing. They've tried, and they've not found not even one. All they keep making is a better Band-Aid. So I was able, through a connection, to get a small study done at the University of Miami Hyperbaric Oxygen Chamber. We took wounds from all causes: radiation wounds, burns, stasis ulcers, pressure ulcers, diabetic ulcers. And after 4 months of supplementation, 86% were healed, were better, 86% less wound volume with more than 50% fully healed, and no recurrences at 6 months.
That was incredible. I'm going to pass this around. This is an 86-year-old patient that fell on her face in the winter. And you will see the healing process. Now, she was taking the oils pre-treatment, but former chair of plastic surgery at MD Anderson, who's also an ENT, was mesmerized by the results and the healing of this 86-year-old. So if this will do this, just imagine the prophylactic use of how nothing is going to get you. 86. So I'm just going to pass this around and you can look at it.
And she did not break one bone.
No broken bones, no concussion, no anything. You can just pass this around just to look at it. It's staggering.
So when we got invited to this conference, I was saying, well, what are the great clinical cases in my backlog, in my history that I could bring up? And so of course, I was running into these things all the time. It's hard to pick the best ones or the most powerful examples. But here's one, a 22-year-old woman with sickle cell anemia. people must have sickle cell patients in their practice. They're always going to crisis. This person had avascular necrosis of both hips. So basically, her hips were deteriorated underneath her from all the crisis she had. She was on the OxyContin, she was on fentanyl patch, and all the big pain drugs, and she could barely walk. She walked like a 90-year-old woman. They wanted her to have both hips replaced. So I said, go on this product. I said, get aggressive. I said, she was smaller. I said, take 8 capsules a day. Go hard. 3 days later, she said she did not go in for her pain prescription renewal. Right? That's ridiculous. I mean, she came off all those narcotic medications in such a short period of time, and she still has not renewed any of her pain medications. And she's working double shifts as a waitress. On a bilateral avascular necrosis of the hips. I've never heard of that. Another patient of mine, she was when she was younger, her parents owned a dry cleaning store, and they would let her play in the drums and stuff, which of course dry cleaning chemicals should not be played with. And then she ended up with chronic migraines, and she was overusing Tylenol and actually ended up with cirrhosis of the liver. So there's a score called the MELD score, which is a predictor of liver transplant. So when she first started seeing me, her MELD score was, I believe, around 42, which translates into about a 76% possibility of transplant. She went on it for 6 months. Remember, these are the only interventions I did. I didn't do anything else with her. She just went on the oils for 6 months, and her MELD score was down to 19. Which means she has less than a 17% chance of a liver transplant. She actually had a recent liver biopsy by the gastroenterologist. They could almost find no cirrhosis at all. And of course, she tells the gastroenterologist, the hepatologist, this is what I've been doing. And of course, the hepatologist goes, I don't think so. Right? What's the first thing the doctor tells you? I did something natural and I got better. And the first thing they say, well, I don't think so. All right. Psoriasis, right? How many people have psoriasis can't get rid of it? All the ads you see on TV, which are ridiculous, shouldn't be allowed to advertise on TV of these medications, but all these biologics come out for psoriasis. This is a guy who just said, I started taking it, a week he noticed a difference. He sent me picture week after week saying it's getting better and better and better. After a month, it's almost gone. He says, he found a huge difference. Even the toughest spots cleared up. He'd been seeing a dermatologist for over 20 years, high-dose steroids, the whole 9 yards. Never got the results he got with this. What else could it do? Like, this is crazy, right? This is a guy I met at a lecture in Iowa, and he goes, Doc, I've been taking those oils for about, I do a lousy accent, but anyways, for about a year now. And I said, oh, well, thank you very much. He goes, I was on dialysis. My doctor says I don't need dialysis anymore. I said, coming off dialysis? Geez, that's crazy. One quick one that just only happened a couple weeks ago. One of my patients who's been following my protocol for about 3 months, she started giving it to her daughter's dog. The dog is a chocolate lab, 14 years old, had bad arthritis. They thought they were going to have to put it down because he didn't want to go outside and pee anymore. Right? That's always the decision. If they're starting to pee in the house, there's a problem. So her daughter didn't believe in this natural stuff, but she says, I'm just going to start giving it to her. So 2 weeks later, her daughter calls her and says, what's going on with the dog? He's now outside chasing rabbits and walking and doesn't want to come in for his walks. They took it to the vet for his checkup, and the vet says, what's going on with the dog? He says, arthritis is so much better. So dogs don't lie. They don't know they're getting anything different, right? And they're suffering from the same chronic diseases that we are because we're poisoning our pets just as much as we're poisoning ourselves. In fact, at a more rapid rate. Because when I was a kid, dogs lived till they were 22. Now they live, 11, 12, 14 maybe? It's really tragic, right? That's coming at us. Yeah. So it's weight-based dosing. Yeah, so it's 1 capsule per 30 pounds body weight. Yeah, but the important thing is they got to take enough of it, and they feel the effect. And I know Brian wanted some question and answer time, so that's that. I just wanted to get a few examples of it, just show you how powerful it really is. And these are things that
Yeah,
as a physician, I
they're
never-
incredible, but these are standard kinds of results in the real world. And they're all predictable because they're all working at the cell level, cell membrane level. So I'm sure you got a lot of questions. I mean, I'll be out during the breaks. You can ask, you can email me questions. But, you know, if you have a couple of questions, could certainly answer them. We've probably got
back
8
there, I think.
minutes.
Back there?
What do we got, 2 minutes? 2 minutes. What do we got?
2 minutes, yeah.
Make them good.
He was first, I think.
So,
Who?
I don't know.
Yell it.
Oh, is he going to point out? Oh, okay, he's got the mic, sorry, he's got the mic. Say.
Well, so we can use this for the kids that they are 30 pounds and
Yeah,
older.
even
I
when
mean,
they're-
more.
Even when they're lighter, you can still use them. Like my dog is 8 pounds, so I give him a capsule every 3 days. But yeah, they're not toxic, so you can't really overdose on it. It's what you need every day, anyways. And you'll never get a 30-pound kid to swallow a capsule, so you're going to break it loose.
There's no age that you shouldn't be getting this. Pregnant women should have this, women before they're pregnant. You get the child from heaven. We've had women that can't conceive, 3-4 months of this, boom, pregnant, and it's the child from heaven. You don't get you don't get anything. It's the way it should be. But because they're so deficient with these oils and they're so critical, and also these oils get ripped out of the woman into the kid. Nature's not real kind. That's why most women take a year to spring back after they're pregnant and they're horrible. Go ahead.
So we've been using this in our practice, and it's been amazing. But could you address the blood thinning aspect, because we've, it does say right on
It's
the
a
label.
natural blood thinner.
Yeah,
so
so-
it's complementary with anything you're using. It will not interfere with it. You'll typically need less of the drug, like Plavix or something. Is that what you're talking about?
Yeah, Plavix,
Or
exactly.
Espinova, or what
Warfarin,
Yeah,
yeah.
whatever they are. You can use less of that, but this is natural. There's no issue.
But can you use this
Yes.
if they're on blood
Yes, yes,
thinners?
yes.
Yeah, you can.
So,
and I have
Yeah,
lots
we have
of patients-
interventional cardiologists doing that. Yes.
And
Okay.
they can have surgery on it and not have to stop for the surgery. They won't have increased bleeding intraoperatively.
okay, because I've had a couple patients that are freaked
Yeah.
out by the label warning.
Understand,
it
but
returns-
take less of the drug.
Yeah, it
When you
returns
get
a-
it measured, less of the drug, not less of this, less of the drug. You
Gotcha.
won't need
Yeah,
it.
it returns the patient's platelets to the more natural state, what they should be doing anyways.
But complimentary, no sweat.
Thank you.
No problem.
All
Think,
right, last one right here. And we got to run.
Like I said, I'll be outside so you can ask questions, but just one to a person.
What are some natural food choices for the PEOs?
Yeah, nuts have them. So whatever they say is, oh, the omega-3 in walnuts is the reason they're good. No, it's all parent omega-6. It's 5-to-1 omega-6 to omega-3. So nuts have them. You better get organic. Eggs have them. A lot of food has it, but the more you heat it up, the more you ruin it. So I recommend a supplement just to guarantee you got it for $1.50 a day tops. You guarantee you got it. Even if you eat junk food, because it goes in as a percentage. I didn't say that in the lecture, but if you eat 50% junk and 50% good, your cells are 50% junk. So if you add, say, 30% good stuff, now you're down to 20% junk. Otto Warburg, 35% deficiency gives you cancer. As long as you stay below that, you're safe. So for $1.50 a day, supplement. Good question. Thank you much.
Excellent.